Depression is relatively common during pregnancy and postpartum as well. So people incorrectly assume you can't treat it during pregnancy. So we're going to talk about the treatment options for depression in pregnancy today. I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And this channel is Medical Wellness. We're here to provide you the real deal information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Based in science.
I think something to start this video out with is that there are things you can do just to support your mental health in general that can also help prevent depression from happening in pregnancy. But these things you should also be doing if you're getting treatment for depression because it helps support treatment.
And we have videos about those things specifically, but just to go over them really quickly, right? Maintaining good sleep, getting movement if you can, eating nutritious meals,
just having support.
Support.
Environment
Yes.
and not super stressful environment if possible.
If possible, yes. So those are the lifestyle changes that we would generally recommend people are doing in conjunction with other treatments for depression.
The treatments we're going to talk about are evidence-based. So these are treatments that we have research supporting their use in pregnancy, and we have research showing that they are effective treatments for pregnancy. And so therapy is definitely one of those options, and it's, for the most part, pretty risk-free, assuming you have a good therapist.
Yes, yeah. Which we have a video on how to make sure that you have a good therapist. So, okay, there's specific types of therapy that are specifically recommended, right? So cognitive behavioral therapy and interpersonal therapy specifically.
For depression in particular, CBT and IPT are the two that we have the most research on in pregnancy for treating depression. That doesn't mean that doing other types of therapy might not be helpful either. I think one thing that's really important is the relationship between the therapist and the person.
Absolutely.
That can be just really helpful and healing in itself.
Right, I think so too. Just being able to have a safe space to be heard and supported, which goes back to the other thing of support, that can be one of the places that you receive that.
And when we talk about doing therapy, I think sometimes people think, oh, I can just go as needed, or I can just go once a month. But really, we see that therapy is most effective when you're doing it at least every other week. That would probably be the minimum, but really weekly is helpful. And for people who are suffering from more severe symptoms, having therapy even more frequently than weekly is important for treatment.
Right, exactly. Okay, moving on from therapy, we would talk about medication options. We have videos about specific medications during pregnancy, and then I think we have just kind of generic videos about postpartum depression and those things. It's nuanced about taking medication during pregnancy, and so we're never going to say yes or no to a specific medication during pregnancy. It's very much based on an individual's symptoms, their history, their family history, other things that are going on in their life, if other treatments have been effective for them, other illnesses that they may have. There's a whole lot that goes into deciding about medications during pregnancy, but we want to let you know that there are options for treatment that are generally effective and generally considered relatively safe.
Yes, especially when you're comparing it to the mental illness, which we've talked about before in other videos. Mental illness has high risk to the pregnancy in terms of increasing the risk of pregnancy complications and increasing the risk of bad outcomes with the babies and the baby's development. So when we're talking about the risk of medication versus the risk of mental illness, a lot of times the medication is safer than the illness. And like Dr. Haynes said, it's really kind of dependent on so many factors. But it's also a recommended treatment in people who have moderate or moderate to severe depression in pregnancy. Doing medication is actually first line.
Right, and usually we'll say medication in conjunction with therapy because it's like you get this much benefit from medication, you get this much benefit from therapy, and if we do it together, you get a little bit additional on top of those individual treatments. they just kind of work in conjunction with each other to help you feel better.
And then other treatment options that are evidence-based for depression and pregnancy are some alternative treatments, such as bright light therapy has some evidence of being helpful for depression and pregnancy. Also, ECT or electroconvulsive therapy, a lot of people choose to do that instead because you don't have to take any medications and it is considered safe to do in pregnancy. And then TMS is another one that we're getting more research about in pregnancy.
So TMS is transcranial magnetic stimulation. You would go into a clinic and they would administer magnets.
Yeah, they use magnets to change the electrical currents in your brain.
Right, and so there are sciencey kind of things that they do to decide where to put it and how much and those kinds of things. So we don't have a lot of information about that right now, but the information that we do have, I think, is encouraging.
Yeah.
Okay, so we just really want you to know that it is totally possible to treat depression during pregnancy, and we really want to encourage you that if you are feeling depressed during pregnancy, that you reach out to your clinicians and talk about the options that you have that are best for you, because we know that it's not risk-free to be depressed, and we don't want you to wait it out. We want you to start feeling better and enjoy this time. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.